FIC Faisalabad. Major content of my presentation is already presented by Dr. Abdul Salam. So I will take only less than 5 minutes, I think, because I'm left with 2-3 slides only. So fluoroscopy is an imaging technique that uses X-rays to obtain real-time moving imagings of the interior of an object. X-rays are a type of radiation called electromagnetic waves, and standard X-rays are like still photographs, and fluoroscopy is like a movie. So this is the basic difference between X-ray and a movie, fluoroscopy. Fluoroscope consists of an X-ray source and an image intensifier along with a display screen to visualize the image. The X-rays are produced from the X-ray tube in the cath lab, and they penetrate a wider variety of objects, but they are invisible to the naked eye. So this is the fluoroscopy machine which we always use in the cath lab with X-ray source and image intensifier and display screen. In X-ray tubes, the X-rays are produced by the bombardment of the matter with accelerated electrons. These electrons are emitted from a heated tungsten filament which serves as the cathode and are accelerated by a high electric potential difference, that is high voltage applied between the filament and a metal anode. So anode, typical materials are tungsten rhenium target on a molybdenum core backed with graphite. So this is a little bit difficult. So this is the basically operation of the X-ray tube from where the X-rays are emitted. There is a cathode and there is a metal anode. Electrons of high speed, they bombard on the anode, and X-rays are emitted from that source. They then pass through the human body and taken up by the image intensifier to create a picture on the display image. X-ray imaging creates pictures of the inside of the body. The images show the parts of the body in different shades of black and white. This is because the different tissues absorb different amounts of radiations. Calcium in the bones absorb X-rays the most, so bones look white. Fat and other soft tissues absorb less and look gray. Air absorbs the least, so lungs look black. X-ray in the cath lab is generated using two different modes, as already told by Dr. Abdul Salam. It is fluoroscopy and cine angiography. So fluoroscopy is used for catheter placement and involves 95% of the total X-ray operation time, but only causes 40% of the total radiation exposure to staff and the patients. Cine is used to acquire diagnostic images and to generate a permanent record of the procedure. And although representing only 5% of the total X-ray tube operation time, 60% of the total radiation's exposure to the staff and the patient occur during cine. This is primarily due to the use of relatively high dose rapid sequence screening required to record into the film. So these are different units already mentioned by Dr. Abdul Salam. This is karma, kinetic energy released per unit mass. Karma is emitted dose and different from absorbed dose. Air karma, karma area product. Fluoroscopy is continuously emitting radiations. They are measured as per minute exposure. And absorbed dose is the amount of energy deposited by the radiation in a mass. It is measured in milligray. Equivalent dose based on the absorbed dose to an organ adjusted to account for the effectiveness of the type of radiation. Equivalent dose is expressed in millisieverts, and weighting factor for X-ray radiation is 1. And effective dose is calculated for whole body. It is the addition of equivalent dose to all organs, each adjusted to account for the sensitivity of the organ to the radiation. So what is frames per second as we see on the fluoroscopy? Frame rate is expressed in frames per second or FPS. It is the frequency or rate at which the consecutive images are captured or displayed. The angiographic radiation protocol has standard practice in both fluoroscopy and cine images at 15 frames per second and 15 pulse per second. Frame rates are associated with speed or motion with which video is moving. If we decrease the frame rates, it will slow down the video, and if we increase it, the video will fasten, and the quality of images is also affected. Fluoro dose is lowest of all imaging modes in cath lab, maximum air karma rate is allowed to be 88 milligray per minute. Cine dose rate are 10 to 20 times higher than fluoroscopy. Patient entrance air karma rates are 150 to 250 milligrays per minute, and maximum air karma rate of obese patients can exceed 2000 milligray per minute. And DSA, digital subtraction angiography, require highest karma rate of 300 to 500 milligray per minute. So this is the visualization of the coronary arteries using contrast agents. The substances used to enhance the visibility of internal structure in X-ray based imaging techniques such as fluoroscopy, CT, and projectional angiography, radiolucent contrast agents are typically iodine or more rarely barium sulfate. Contrast agents absorb external X-rays, resulting in decreased exposure on the X-ray detector, and various sorts of iodinated contrast agents, they exist with variations occurring between the osmolarity, viscosity, and absolute iodine content. ALARA principle is as low as reasonably achievable. The imaging procedure should be judged to do more good. For example, diagnostic efficacy of the images, than harm, that is detriment associated with the radiations. Therefore, all examination using ionizing radiation should be performed only when necessary to answer a medical question, treat a disease, or guide a procedure. So these are different angiographic views, left or right, cranial or caudal, oblique or plane, and the display screen show angulation at which image intensifier is set to take the image. To take the image of the coronary arteries and other structures using contrast media, primary operator uses catheters to inject the contrast in the relevant target vessel. Machine operator adjusts the machine X-ray source and image intensifier at appropriate position. There is a foot pedal to control the fluoroscopy and cine, and image is displayed on the screen. So this is an image of fluoroscopy based on all these principles in different view. One is LO view and second is RO view. It shows the use of contrast into the coronary artery, which is displayed using X-rays by the fluoroscopy and cine angiography. Thank you.
Thank you, Dr. Naeem Hamid. Is there any question from audience? Thank you. Finally, I would like to thank all the chairpersons, presenters for informative, interesting talk, and the audience for the attention. Hopefully, this will be very helpful and beneficial for us. And then I would like to call Mohammad Ashfaq for next moderator.